listening to the Minister speaking on radio today, David Cullinane, he said, look, there isn't an emergency department across Europe, some of the best resource healthcare systems across Europe, that isn't under huge strain at the moment. And he mentioned Northern Ireland and the United Kingdom as two examples where it's just as bad, if not worse, here in Ireland. So we're not alone. Is that a defence?
It's a cop-out. Obviously, rising presentations and rising COVID and flu cases has an impact on any healthcare system. I appreciate that. But the underinvestment and lack of capacity is exacerbating the problem. It should not be normal, Ciara, that patients are on hospital trolleys for days on end. We're hearing reports of people sleeping in emergency departments on the floor, many of them in pain, older people over 75 left for days on end on hospital trolleys. It has become normal. It was entirely predictable. We had a summer trolley crisis. The alarm bells were going off. Everybody knew that this was going to be a disaster. And for decades, we've had conversations and commitments and spoof, it has to be said, from some ministers for health that we would take a zero-tolerance approach to people in hospital trolleys, and it has got worse. We don't have the beds. We don't have the staff. The minister was saying today that he wants consultants to come in and work over the weekends. Many of them are. They're broken. I've spoken to many nurses, doctors, consultants who are broken because of COVID. They're working huge amounts of overtime, and they get very hurt when they hear that from the Minister for Health because they don't have the tools to do the job. I spoke to Anthony and others about ICT infrastructure, deficits there. We don't have beds, we don't have staff, and we're asking people on the front line to operate with one hand tied behind their backs, and patients are really suffering. So this is a watershed moment in my book. We can no longer tolerate what's happening in our healthcare system. We can and I don't think we can tolerate spoofing from a Minister for Health. We need more urgency and more action.